Hi guys! We are going to teach you guys today about measles, also known as rubella. We made a pamphlet to go along with this. We have attached it to Blackboard underneath this video link and discussion board, so you guys have access to it while we're studying and while you're watching the video. I'm going to start and go ahead and tell you guys what measles is and then the signs and symptoms of it. Measles is a respiratory disease that's highly contagious, and it's caused by the measles virus. There is a vaccine that's safe and fairly cheap that will prevent the measles virus. Signs and symptoms include a blotchy red rash all over the body, fever, cough, runny nose, red watery eyes, sore throat, or tiny white spots with bluish white centers on a red background on the inside of the mouth. And most symptoms don't start until 10 to 14 days after you've been exposed to the measles or to the virus itself. So there's a period of time where you may have it and may be giving it to other people and you don't even know.
The incidence of the disease, there are a lot of things that affect how the susceptibility of the disease. According to the World Health Organization, the unvaccinated young children are the highest risk for the disease and the complications that are associated with the disease. Another factor that affects the susceptibility of measles is where you live at in the world. The more rural areas that don't have vaccinations available, that's where it's going to be a lot more common. So here in America, since we have vaccinations available pretty much anywhere, it's pretty rare. There's only 60 cases in America per year, and across the world, there's about 20 million cases of the measles per year.
I'm going to talk about transmission of measles. Measles is a virus, and it's highly contagious, and it tends to affect 90% of the people that come in contact with an infected individual if they're not vaccinated. A person with the measles can spread the virus to other people for a period of about 8 days, and this period starts 4 days before the rash appears and then 4 days after the rash has been present. The measles virus typically thrives in the cells that line the back of the throat and the lungs. And according to the World Health Organization, when the infected individual coughs, sneezes, or is in close contact or even direct contact with those like secretions from the throat and the nose, they're likely to become infected. And the virus is in the air or on an infected surface actively and for up to 2 hours and can allow people to become infected.
So prevention is one of the main factors that has created measles to become extinct. It is primarily extinct in our generation today, but prior to 1957, immunizations weren't given. So anybody who did not have the infection or was born before that time period did not get the vaccination. So those are the ones that you have to worry the most about getting it. Since the initiation of the vaccine, the illness has become almost extinct in the United States, like I said before. But in order to prevent it from coming again, it is important that we still continue to have those vaccinations. For those that are already contracted the illness, it's important to keep in mind that it is extremely contagious. You want to make sure that anybody who does come in contact with it is taking proper precautions, and those that have siblings that may get it, make sure that you're keeping them distant from each other. Also, it's really important for parents to interact and keep it separate.
I'm going to talk about the prognosis and treatment. Most individuals that get measles will recover quickly. Only 2.2 out of 1,000 people that get measles will die. If an individual gets the measles when they are malnourished or immunocompromised, they are more likely to have complications or die. It is very rare to die from measles if you get vaccinated. Also, the treatment of patients with measles is mostly focused upon symptom relief because the vaccination prevents measles, and then once you get it, the only thing you can focus on is the symptoms and specific complications like pneumonia. You're going to have to get an antibiotic, and patients with a fever should be on bed rest and well hydrated. And then once you have the measles, you have to be isolated in order to prevent the spread.
And like we said, we decided to do a pamphlet not only for the purpose of studying and to help you guys, but also we thought that it was kind of a cool way to work in teaching, like patient teaching in a clinical setting, because pamphlets are something that you can get in a doctor's office. They're easily accessible and they're fairly cheap to produce. So it's kind of cool to create this, and hopefully it helps you guys with studying. Thanks.
Thank you.